Teddy, darling, are you ready? Okay, all right. Good. Oh, and it's hello and welcome to Pet Talk with me, Anna, and Teddy. And we would like to introduce our guest today, Dr. Bella O'Connell. Thank you very much, Teddy, for helping out. And welcome, Dr. Bella.
Well, I'm very happy to be here, Anna. Thank you for inviting me. I'm delighted to be able to talk about this topic.
Well, it's such an important thing. I was reading an issue of the Animal Therapy magazine, and I came across your article, Leaky Gut Syndrome in Pets. And I thought, now that's something that we've not talked about on this program, and yet it's something really important. So here you are, and I'm very grateful for that. To start off with, for those who are unfamiliar with the term, what is leaky gut syndrome?
Sure, that's absolutely the first question that needs answering. You're quite right. So it's basically where the gut lining is faulty. So it's allowing things into the system, i.e. our bodies, our pets' bodies, that shouldn't really be able to get through the barriers that have been put in place to make sure that all the checks and balances are done to make that the right nutrient form and the right nutrients themselves get through. Toxins and other harmful substances are kept away. And also nutrients that are meant for the microbes rather than us remain in the gut to feed the microbes and don't get through and cause inflammation in our bodies.
So, so to sum up then, what the stomach lining does is act like a filter and
Yes,
allows that which is good for us to go into the bloodstream, and it keeps out anything that is bad for us, and then that gets excreted
that's it.
from the body. Okay, so this is the same, for animals as it is for humans, and so clearly this is a really important thing. And if that isn't working, if that filter isn't working, we're in trouble. So
Yes, big
what
time.
what is it that undermines the integrity of this of our stomach line of the stomach lining of animals and humans?
Yeah, so just to go back a little bit, if you like, which might be helpful, is that the gut microbiome is, or the microbiome in life generally, is incredibly important to our good, the functioning of our health. It keeps us healthy, and if you destroy it, we get very unwell. And the microbiome is everywhere. So it's in the air we breathe, the water we drink, the food that we eat. And the microbiome, as part of us, starts right from the skin, and it's in the mouth, and it goes into the esophagus, which is the tube from the mouth to the stomach. It's in the stomach, it's in the small intestine, it's in the large intestine. So it's absolutely everywhere. It's critical to our health. And there are not just millions or billions, there are trillions of them in us. And in evolution, they came here way before we did, and they fashioned us around them. So the reason that's important is because the microbiome, if it's assaulted by toxins or various chemicals, acids that may not be the right sort of compatibility to what's meant to be ingested in that species, then that's when the gut starts to fall apart. So it's meant to be not just a filter, but actually quite a barrier. And what I like to suggest is a little visual signal here. So you've got two gut cells bound together by a tight junction, and it's like Fort Knox. Unless you've got the right pass key, you're not going to get through. There are lots of little chemical and hormonal sort of signals here. And if you've got the right key, then things will open up. That nutrient can come through into the body and do its magic, gives us energy. The cells can repair and do the jobs that they're meant to do. With leaky gut, what is happening is all the assaults to the gut lining are causing that tight junction to fall apart. It gets very inflamed. Not just because of the stuff in the gut coming through with food and water and chemicals, but the other side of this gut lining, if your food or your nutrients are here and this has started to open, your immune system is just here. So they're like the security guards. So you've got your pass key, and then they're going to want to check your bags. So that the security guards are here, and if they don't recognize you or they think you're in the wrong form, they're going to cause inflammation to try and take you out. They want you to get back to where you were, you're not allowed through. That system can get really out of control and inflammation ensues, and it then is a sort of self-automating kind of cycle where it can't stop, and that's when autoimmune disease happens. Inflammation ends up almost anywhere depending on the genetic makeup of your body, depends on what bacteria or microbes might be getting through that shouldn't, other sort of assaults to the system in the body that shouldn't be there at all.
So, if I'm to understand correctly, the gut microbiome plays a part in keeping that stomach lining healthy.
Yes, it's critical to the whole managing of the whole situation. Back in evolution, the we had single cell prokaryocytes, which were the first living organism on Earth, and in time they started to become a bacteria, and bacteria then fashioned a sort of they coalesced and coordinated themselves to have a lining around them to basically protect them, because it's all about continuing the species, continuing life in the form that you want it. So humans reproduce, so do our pets, and the bacteria, of course, want to reproduce, and they want to be safe and get the nourishment they need. So they fashioned this sort of, I suppose, their home. They had this filter around, or this barrier around, which they could control to give them the best chance of being able to replicate. So I would suggest that was the gut. That's the very first thing that came into being in that form. And from there, then we had, the design that we've become, the dogs, the cats, the humans. But the gut was the very first thing. And I think that's quite a big thought when you work right back, giving it the sort of importance that it's due.
Indeed, I mean, it's fascinating to hear you describing it that way, as an evolutionary, almost an evolutionary event. As soon as we understand that, that immediately flags up how so many things begin with the gut. Why it is that so many things begin with the gut, and we have this issue around the integrity of our stomach lining and why that's so important. So now that we understand that, what is it that causes such a problem with the gut microbiome in our animals?
Sure. So it's very similar to humans, I guess. That I would say the very top of the tree is the antibiotics, sadly. And I'm not against medication. I work in general practice and I use them as needed, but I use them far less than I used to because I recognize the damage they cause. So you give a broad spectrum antibiotic and you are basically putting an atom bomb in the gut to the microbiome. And why that matters is because each of these microbes, all trillions and trillions of them, they all have a job to do, and destroy them at our peril, because then they can't do the jobs that they were doing to keep us healthy as well as themselves. So we get very unbalanced species. Some may proliferate, some might die off. And then when you've got an unbalanced situation, certain microbes can become what we call pathological. So instead of being just in a calm situation where they were doing the job they were meant to do, they get far too numerous and then they can cause harm to the gut wall. So that's one thing that can happen, which is the antibiotics. Anti-inflammatories also, the non-steroidal anti-inflammatories are known to cause issues in the gut, and there's always warning signs on things like ibuprofen and other sort of mainstream non-steroidal anti-inflammatory medications about if you have any gut problems, you shouldn't take them. And vomiting and diarrhea and not eating are all signs that you shouldn't be taking those medications, because they're known to have a gut lining effect, a negative effect. Okay. So those are two medications. Various chemicals. I mean, chemicals in our modern living are inevitable and we can't get away from them. They're in the air we breathe, the water we drink, the food we eat. I would suggest we can do quite a lot about the food. I'm not a fan of ultra processed food because it has things in the food that are not found in nature. And I think we all know that nature is an awful lot smarter than we are. I always say to people, the minute a human can design something as incredible as a bird, so say like the swallow, I'll take note and I'll perhaps use that design over something in nature. But honestly, the complexity of nature, the older I get, the more in awe I become of it. And I think we ignore it at our peril. I really do. So fresh food is better. Ultra processed really isn't great because it's got things not found in nature. There are lots of arguments as to why people might choose that, being convenience. They might consider cost would be a part of that, which I would debate, I'm afraid. But if we can take out things not found in nature, and that happens in a lot of products as well, so like toothpastes that are used on dogs and cats, even down to things like chemical wormers and flea treatments and things. Um, they're absolutely widely used, but we know that certain ones, if they go in the water with certain products, it destroys the marine life. They are not benign products. And in fact, in all the conferences I've been to in the last 5 years, they're always telling us, please test the feces for worms. Don't just routinely give a wormer. And I think that's very responsible because we're taking care that we don't pass on nasty things, but equally, we also don't want to ruin the environment by just doing a routine, regular thing unnecessarily. So there are, of course, times when you want to use these things, but I think as a routine situation, that's not healthy for the pet. It's not healthy for us or the environment. And you can very easily online get a little kit, which is for a worm egg count, get them sent off, a little sample in a little tube, and the answer's back to you in about a week. I think the latest cost I was looking at for the most basic thing is £18.50. So it's also cost effective. Farmers do this all the time with their sheep and cattle and other animals, and horse people do worm egg counts a lot as well. They don't just routinely worm. And I think all the professors in these conferences are trying to get the small animal people to do that too. And there's a good reason. It's better for all round.
It stands to reason that if you are putting a product into your animal which is designed to kill something, it's not a good idea. It's just so obvious that we are not thinking, because the minute we think about what that product is actually doing, it becomes obvious that it's not a good idea. So, okay, so I want to come back to the idea of the imbalance of the microbiome being the problem, because we are taught all the time that there's good bacteria and bad bacteria. But what you're saying is actually it's about keeping everything in balance.
Nature knows what to do. If it's in balance, it works. If it's out of balance, it really doesn't. So I think, yes, I mean, it's there's so much to that, but also we've found out recently in the last 10 years that certain bacteria can be totally fine unless, for instance, it's stressed. And believe me, when it gets stressed, it becomes pathological. And I find that completely fascinating that you can actually, through your own being, if you're very stressed, having a terrible time, that you can actually, your bacteria in your gut can turn very nasty and cause harm to you. So they talk about having a stressy gut and you've got sort of, a colitis, or you've got terrible muscle tummy spasms, that sort of thing. Probably because that's exactly what's happened, and the bacteria that were doing a perfectly good job have become out of balance, and that the pathology has been set up, which is harmful. They do talk about the microbes as well, so it's a two-way street, isn't it? They talk about the gut microbiome being the second brain, but I think you probably understand why I call it the first brain from the evolutionary point of view. And they've shown that 80% of neurological signals go from the gut to the brain and only 20% the other way. So I think we can all agree that who actually is running the show is not us ourselves at all.
No, and I think we know that because it's in our language. We instinctively know it because we talk about feeling things in our guts, etc. So I think instinctively
Absolutely.
we know, and I think our ancestors probably knew that, but we have forgotten and are just rediscovering this. Um, okay, so let's come back to the idea of stress then, because we could be talking about physical stress, which you've already talked about, the antibiotics, other drugs, a poor diet, etc. But there's also, it seems, emotional stress. So, what do you think is
Yeah.
there? Is it that there are some bacteria that are acting to protect themselves, to protect the body because of a perceived threat?
I think that's very much part of it. When you get the microbiome being attacked by stuff, then it's going to retaliate because it does want to survive and do the best it can to keep going as a species. That's the same with any living thing, I would suggest. Um, and I suppose when that happens, it's definitely going to affect your brain or your pet's brain. So a lot of separation anxiety, stressy dogs have a lot of gut problems. And which came first? It's hard to know, but there will be a slight genetic component as well to gut stress, probably. But there are many things that you can do, and diet is absolutely the number one thing that you can address, which doesn't require testing particularly, but you just have to feed a food that's actually going to calm everything down and rebalance the whole situation. Food wise, I think I touched on the ultra processed food. You've got a lot of chemicals not found in nature in them, just the same with human food. And we know that it causes obesity, anxiety, mental health issues, inflammation in any part of the body. One of my favorite studies that I've seen had a lovely, I'm quite a visual person, had a lovely diagram of where all the inflammation can end up. And there was literally no cell in the body it won't affect potentially. So you can get pancreatitis, you can get dermatitis. Inflammation of the skin is so common in our pets. They get ear issues as the start. Anal gland issues are really impacted and itchy, and they get chewing their paws. They can get kidney disease, heart disease, liver disease, all inflammatory diseases that can really, really adversely affect the whole system just by feeding the wrong food. So it's a very powerful thing to then go back to basics and start thinking, hang on, this is a dog or a cat. They have no chewing teeth. They're ripping, shredding, tearing teeth. They're very sharp, and they're not meant to be having lots of grains and vegetable matter that needs a lot of work. Their gut shouldn't be having that, and it really has a hard time dealing with it.
So I want to take you back to heart problems. Would this include heart murmurs? Because I keep hearing about heart murmurs amongst Teddy's friends. So would that also include, would that be an inflammatory condition?
It can be. Heart murmurs, the actual description of a heart murmur is turbulent blood flow in the heart. That's what you're hearing. So it could be from many, many different causes. So there can be valves, there can be strictures, there can be a flabby heart muscle, and of course that doesn't include rhythms. So you can get arrhythmias as well. So inflammation can definitely play a part. There is a condition called endocarditis where they get these nodular lesions on the valves, and definitely going to hear a murmur there, and that is most certainly an inflammatory thing. It can also be due to infection. If there's a bacteremia, we know that with dirty teeth with people, it can cause endocarditis. I'm quite sure the same happens with pets. It's not as common as other things like mitral valve disease and Cavalier King Charles Spaniels, sadly. They get it a lot, but I think they're trying to breed it out very sensibly. And they can get enlarged hearts with some of the giant breeds, and that's potentially a genetic component. However, I always go back to the point being no matter what your genes load the gun, the environment pulls the trigger. So if you want to do everything you can, get the diet right, and you minimize the risk of it actually becoming a problem.
Speaking also of genetics, it's put me in mind of the fact that we have several generations now of animals who are eating ultra processed foods. So it's and also being exposed to antibiotics, etc., and the toxicity within our environments from the chemicals we use at home, and so on. It's making me wonder whether any animal now living with us has starts off with a healthy gut.
I think it's becoming increasingly rare, but and they've shown this in humans, haven't they? That it's what your great grandmother ate, which affects you as well. So it goes right back, probably further, but they're doing all the studies, and it is a fascinating area of science. However, there is hope. And my favourite thing to do for a dog that's really struggling is the fecal microbiome transplant, because you're using nature to fertilise the gut. Nobody's doing anything fancy. It's a really simple procedure that you can do in general practice. However, you have to find the right donor. And that is hard because of what you've just mentioned. I don't want my donor having eaten ultra processed food and had antibiotics and non-steroidal anti-inflammatory drugs, because it won't be putting the best microbiome in that very sick patient. They have done studies on puppies with parvovirus, and they've given them fecal microbiome transplants every 6 hours, and it's been incredibly helpful. They've lived, they've got better more quickly. There are obviously many more studies since that original sort of very well-known study came out. But Edinburgh University are really leading the way on this, the Royal Dick Veterinary College there, and they've got a great protocol going. You will find people making capsules of freeze-dried feces. I would go back to the point that that is it's second best. It's far better than nothing, but we've manhandled it, we've processed it. It's not what nature was like initially. And if you can do a fresh fecal microbiome transplant, I think it's a lot more effective, probably, with the right donor.
With the right donor. Okay. So I'm just thinking about that because I can imagine that's animals are not going to appreciate. I presume this would be under anesthetic.
No, that's where it's so interesting, isn't it? So, if I explain the procedure, you get the donor feces and you get it tested for anything that could be pathological. And if it comes back clear, then on the day of the procedure, you get the fresh sample. You then whiz it up in a food processor with sterile saline. You then put it through a sieve. You draw it up in a syringe, and you use a long dog urinary catheter, which is no wider than a thermometer, probably slightly less wide than a thermometer. It's incredibly easy to do. It's incredibly well tolerated, and you just insert the contents into as far as into the large bowel as you can get the recipient situation with them being calm. On the whole, I've only had to give them a mild sedation. Most are unconscious. When you're doing cats, it's a different story. Cats are not so compliant. So yes, I have given them a heavier sedative. But again, the cats I've done this on, I've only ever had to do one. I haven't done many cats, but the ones I have done, it really has saved their life because they were right at the edge of not doing, and we were talking about euthanasia. So it is a very powerful tool that we can all use as general practitioners if we just find the right donor and know the protocol, which is extremely simple, as I've described.
We were talking about the immune system earlier because of its proximity to the stomach lining or
Yep.
the lining. So, would it be a fair assumption to make that allergies are related to the gut microbiome then?
I think it's certainly a very interesting part of disease. I think allergies. So if we maybe we start with talking about food allergies, because I think that we'll start there and stem from that with the skin. But the food allergies, that people say my dog's allergic to this, that, and the other may or may not be an allergy. It might be an intolerance, or it could just be because that food item was not species appropriate, or it could be that that food item has been brought up on chemicals. So it might be the vegetables or the meat or whatever. So, for instance, when I'm consulting in my nutrition vet practice, I will say to people, let's just avoid intensively reared meat because most of the meats, A, they're stressed, B, they're fed a lot of grain, C, they get a lot of medication for productivity, and therefore that comes through in the food chain and most definitely will affect us, our pets' health generally in the microbiome. I always say to get people around the concept, microplastics are everywhere. They're in the Arctic now. So it does come through the food chain. It's like heavy metals in things like tuna. The bigger the fish, the more heavy metals they accumulate. So we know this happens. We can't avoid it completely. But I think when we're so fortunate in the UK, we've got pasture-reared animals, we've got wild animals that have a lovely life. And then they humanely killed. So those meats are the ones that I prefer. So you've got beef, lamb, venison, wild game. The only exception to that for me, because I know this is a very well tolerated food, is plain white fish. It is farmed. I would not encourage people to do farmed salmon, but plain white fish from the Nordic countries, it's a lot less crowded up there. I think the disease is far less. It's much colder water, and therefore they don't have to get so much of this inappropriate food and medications. Again, I always say perfection's the enemy of good. You can't have it all. The microplastics are everywhere. There are certain things you just can't avoid. But working on pasture-reared animals is great. There's a lot of misleading labeling and marketing as well. So free range is very tricky because, of course, we know that the free range, the legal scenario is you just have to have access to the outside if you're a barn reared hen. But knowing that there are thousands of hens in the barn, they have a hierarchy and they will have bouncers on that little hole in the side. And most of the hens won't have access to get outside. So it's a bit of a shame, but knowing animal behavior, that's what happens. So they generally are inside. So, yes, that's a very important part of the whole thing.
I am so glad that you have brought up the quality of the meat because we often talk about nutrition on this program. And obviously, getting away from ultra processed is number one. You want things to be fresh. But you're the first person who's actually brought up the quality of the meat. And I stopped years ago feeding Teddy, even the raw food suppliers, because I wasn't satisfied with the provenance of the meat. And I basically, he eats wild meat.
Yeah.
And that's what I get for him, is he gets wild meat because it's not expensive.
No, it really isn't.
It is. But when I say this is what he eats, people go, "Oh, it sounds so posh." But
No,
actually, it's some of the cheapest meat I can get for him,
yeah.
and I'm confident about the way that it's lived, and I'm happy with that. And we are living by the sea, so fish is not difficult either,
Brilliant.
thankfully. So I think it's interesting because it comes back to confidence. And I think we've lost our confidence in our ability to feed our animals because we're told that only things designated for them are species specific, and will have all the nutrients they need. But actually, it's not that simple.
Oh my goodness, I'm so glad you brought that up. The term complete and balanced is quite misleading, I think. It prevents deficiencies, but it certainly isn't going to help them thrive. There's nowhere on earth that we should eat the same thing every day. None of us. A varied diet is important, but it's got to be species appropriate. So a varied diet over 2 or 3 weeks, just like you and I would eat, will give you all the stuff you need if you know what foods are the best ones to eat. So it's definitely the provenance of the meat, but the same goes for the fruit and vegetables. This is something that a lot of people find. They say, "Oh, these superfoods, this mushroom or this blueberry, have these incredible studies behind them," and that might as well be, but they're not for pets. So first of all, look at the pet you've got in front of you. What species is it? Is it a cat? Well, they've never seen a blueberry in their life. They wouldn't want one anyway. It just isn't the sort of food you should be feeding them. Might their prey have eaten a blueberry? Probably not. They're rats and mice, aren't they? And birds. So it's unlikely. Or if they did, a tiny, tiny bit. And going to blueberries again, the way the blueberry is farmed now, they're huge. They are not probably grown in the ground. They are full of fructose and they're probably not in season, so that they have lectins, which are gluten is a form of lectin and can be very irritant to the gut lining. So there's so much nuance to this. So I always say to people, seasonal, local, if you can, organic, but that's not, it's not absolutely necessary, because organic means they've got to have gone through a very, very expensive protocol to get the organic status. And if you have somebody local who has a little market garden and you can ask them, then you know their provenance. And the same goes with the farmers and the farm shops. There are bespoke commercial raw food suppliers in my area that do UK pasture-reared and UK processed meats, and they make a big thing of it on their website, and they say they go and inspect the farms as well. And I would say that's what you want to check when you're looking what raw food to get. That's what you should look at. And it doesn't have to be raw, even it can be lightly cooked. Again, if the ingredients are great, often older dogs do better on lightly cooked because that gut lining is older. We don't all look 20 anymore. The skin is older, so it doesn't function quite as well. And the gut is no different. So we just have to think about the life stage also.
That's brilliant. Let's talk a little bit more then about the aging gut lining. So how does that, you've said, sometimes it's better to have lightly cooked for that reason. Is there anything else that those who have older animals might consider with respect to the health of the microbiome in the gut lining?
I suppose if you've started as early as you can to keep it healthy, it's like anybody. If you exercise it properly, it's going to manage for much longer on a great variety. It's in regard to just a broad brush of an older pet, I would just take it a step back and say, what are the symptoms? So I'm always asking people, how much does your animal poo a day? What does it look like? Does it smell really horrendous? Um, do they have a gurgly tummy? Do they belch? Do they fart? Do they look painful in the tummy sometimes? Do they do this stretching out thing? Because I can't see the gut. I can only ask questions about how it's functioning. And the answers to all those questions tells me precisely what's going on as far as we can know. So it's really useful, even in the older pet, to say, right, how's it going? And if those symptoms have changed, then we address that with various things that we can do to help. A lot of people ask me about supplements, and I would say supplements are not from nature, but they can be useful, but use them with caution, because the supplement market in any country, I think, pretty much is not regulated. We know from many studies done that supplements are not always what it says on the label, either through lack of rigorous lab testing or deterioration through transport or storage. There are things that can go wrong in the supply chain of it. So I like to introduce what I call organotherapy, which is a very smart way of saying, if you have a liver problem, give liver. If you have a heart problem, feed heart. If you have a gut problem, feed tripe. Do you see what I mean? Because nature supplies everything that is needed for those organs. So you put healthy, whatever it is, into the diet, not in big quantities, because again, if you put too much liver, you can get problems, and you can cause diarrhea and all sorts if anything's introduced too quickly. But really, going right back to these things, it can be incredibly helpful to supply the organ that is not doing so well. Just on a personal note, I've had a dog with heart failure at 14. All she would eat at the end was heart. They just know.
Yes, but also if we look back at um, traditional medicine,
Yep.
the idea of treating by sympathy, meaning give like for life, to
Yes.
like,
Yes.
is
Exactly.
there. So,
Hmm.
and these are things that we always knew, but it seems that we forgot.
Yes. Well, it's what did Hippocrates say 2,500 years ago? It all starts in the gut. I mean that's never been truer, and I think luckily we're sort of coming revisiting that situation, and hopefully becoming a bit wiser because of it, and paying more attention.
Well, Dr. Bella, I just want to say thank you so much for such a wonderful amount of information and such clear explanations. I am very hopeful that everyone watching will have got a tremendous amount out of our conversation today. Thank you.
Oh, not at all, Anna. It's been a pleasure, and I'm always delighted if people are going to concentrate on getting the gut right, and then we don't have these chronic diseases.
Perfect. So, if people want to find you, how do they do that?
I have a website called the Nutrition Vet, and then they've a contact form there, but there's also an email address. So either will do. And we can talk on Zoom, or if people are local, they can come and see me. But generally, Zoom's perfectly acceptable. And I like them to fill out a questionnaire. I talk a lot about poo. Very important.
And what does local mean? Where are you?
I'm in Dorset.
You're in Dorset. Perfect. So those who are in Dorset are extremely lucky, and those who are not can still get in touch with you. Thank you
Yeah.
again for your time today.
Thanks, Anna. Lovely to meet you. Bye.
And thank you all for watching. Now, you can find the information that Dr. Ball has just given in the description box. And you will also find there a link to my Substack on which you might just find some of the Mummy and Teddy adventure stories. Until next time, goodbye.